Hi, so today I'm going to be talking about tetralogy of Fallot, which is a congenital heart disease. So this heart disease is really rare. It's something that is diagnosable at birth, which is the reason it's congenital. Um, so what this condition is it is a combination of 4 heart defects that all are present at birth, and basically it needs surgery within the first year of life and multiple surgeries throughout the rest of your life. So, a lot of surgeries. So this specific heart defect is something that causes oxygen poor blood to flow out of the heart, which is bad because your body needs oxygen and your red blood cells, and the low oxygen blood goes into the rest of the body from the heart. Alright, so the four components to this is, so there's this thing called VSD, which stands for ventricular septal defect, and this is when there's a hole between the 2 ventricles in the heart. The second one is called pulmonary stenosis. This is where there's a narrowing in the blood vessel leading to the lungs. And 3, overriding of the aorta. So this is where the aorta is right above the VSD, which is the hole between the 2 ventricles, which is a big problem. 4. So as a result of all these effects together, causes a thickness of the right ventricle. Since it's working so hard and there's extra blood flow, it becomes thickened and one side of your heart is bigger than the other. So the way this is diagnosed is actually really simple, because if it's not diagnosed, you're gonna die. So what happens is when children are born with this disease, a lot of the time, since they're not getting enough oxygen, they become blue in the face from lack. And that is one of the main symptoms. So that happens, and within the first year or so, a patch is put on the heart in order to close the hole between the 2 ventricles. And after that patch, about years later, when the heart is the right size and it's done growing, they will insert a valve. The way they insert this valve can be 2 separate ways. 1, open heart surgery. Not the best way to do it, but people still do it. It's a very, very scary procedure, I'd like to say, but no. So they can cut the chest open, insert the valve that way, but the second procedure, which is a lot easier in a sense, is putting a valve up through the artery through the leg, which only have to be in the hospital overnight, takes a few hours for the doctors to get done, and the recovery time is way faster and way easier for the patient when instead of open heart surgery. So growing up with this disease, these patients face a lot of difficulties. Shortness of breath, which is usually before a lot of the difficulties are before the valve replacement. So before people get these valves replaced, a lot of the times they have a lot of issues with shortness of breath, like exercising, and any sort of athletics in general.
Any activity that this patient does, we're talking about children, babies, like crying, they're feeding, they're playing, it's going to put a lot of stress and demand on that heart. And as we just seen, the structural defects don't allow the heart to be able to work correctly under those type of conditions. So it can't replenish the blood with oxygen.
So a frequent routine for people who have this disease have to go to a cardiologist at a hospital, usually once a year or every 6 months if that's before you have the valve replaced. So what that looks like is you go in, you get an EKG, which is an echocardiogram. A lot of times they also do ultrasounds on the chest. X-rays are done, and then usually a long talk with your doctor, and you find out how things are doing, how can things be improved. But yeah, I think the best part about this disease is that now there's a lot more treatment for it. It doesn't really decrease your lifespan as much. It doesn't really, after the valve's replaced, it doesn't really affect your daily life other than the fact that you do have to go to the doctor every year. Overall, this disease is something that is treatable, and most of these patients have a long-lasting life.